We will begin in about 4 minutes. We will begin in about 2 minutes.
Good afternoon. This is Tracy Aaron. I'm the Health Education Director at the Lake Cumberland District Health Department. Thank you for joining us today for our weekly update regarding COVID-19 across the Lake Cumberland District. We have members of our executive team here that's going to be asking some questions that you all have submitted over the past week. Sean, do you want to give us an update before we start?
I will. Can you hear me okay?
I can, yes.
All right. So I'll give you a side view here as I review our situation board. I'm back in our dock this week after having 2 weeks of quarantine for being a close contact to a case. So it's good to be back at the office. So far in Adair County, we've had 243 total cases. Of those, 9 have passed away. There's 215 released, leaving 9 active cases. 1 is hospitalized, 8 in home isolation or self-isolation. Casey County, 221 total cases, 12 deceased, 195 released, 14 active. Of those, 12 are home isolated, 2 are in the hospital. Clinton, 53, 1 deceased, 39 released, 13 active at the moment, 11 of those home isolated, 2 in the hospital. 69 total cases in Cumberland County with 0 deaths, 61 released, 8 currently active, all on home isolation. 70 total cases in Greene, 2 deceased, 43 released, 25 currently active, 24 on home isolation, 1 is hospitalized. In Macquarie, 55 total cases, 0 deceased, 46 released, leaving 9 active cases. 8 of those are home isolated, 1 in the hospital. 409 total cases in Pulaski, 5 deceased, 353 released, leaving 51 current active cases. Of those, 44 are isolated and 7 are in the hospital. 149 total cases in Russell, 5 deceased, 125 released, leaving 19 active, 17 on home isolation, 2 in the hospital. 158 total cases in Taylor, 3 deceased, 132 released, leaving 23 active, 19 of those home isolated, 4 in the hospital. 80 total cases in Wayne County, 0 deaths for Wayne County, 69 released, leaving 11 active cases, 10 of those isolated, 1 in the hospital. That's 1,507 total cases through yesterday evening, 47 deaths, 1,278 released, 182 current or active cases. Of those, 161 isolated at home, 21 in the hospital. So the number of people we have in the hospital, it's not the highest number that we've had, but it is a high number. And as we've been saying in our daily brief, the average age of our hospitalizations is a little lower than you might expect. The average age of our hospitalizations, when I checked it a day or two ago, of course it could have changed some. We could have had a couple come out of the hospital, a couple go in. But when I looked at it a couple of days, the average age was in the 50s. Of our total hospitalizations, of that 1,270 or 21, well, I don't have the total hospitalizations right in front of me, but out of all the hospitalizations that we have had, a surprising number of them have been, 60 below. So this is certainly, as far as hospitalizations go, it's not just the most high-risk group, and that's certainly of a concern. So the biggest issues that's been going on the last few days has been the debate in the local counties about whether or not schools should return to in-person instruction. Lots of strong feelings about this issue on both sides of the aisle. From a purely public health perspective, thinking about the disease, any activity that encourages social gatherings should be strongly discouraged until there is a vaccine. We know society won't tolerate but a certain amount of restriction, and therefore you have decision makers at all levels of government, at the federal level, the state level, and the local level, like at school boards, trying to make decisions of how much normal can we have without creating a unacceptable spike in cases, which would then in turn turn into an increase in hospitalizations and increase in mortality. So those are things that we're sincerely struggling with. Obviously, there is merit to the arguments on both sides of the issue. Kids are missing out by not being able to go to school in person, and there are societal consequences to kids not being at school in person. There's also the public health concern of the increased hospitalizations and mortality from a community spike. Do we believe that schools can be safe? We believe the schools have put together plans to the best of their ability to be as safe as they possibly can. But if you're putting thousands of kids into a confined space for several hours a day, the disease will spread. Now, can it be kept at a low enough level you can continue to go to in-person instruction? We're going to find out. About half of our schools in our district are going ahead with in-person instruction, and half of them are going to wait a little bit. We've already had one of our private schools in our district that opened up a few days ago already have a cluster of cases and have to close. They closed and I guess rolled up virtual instruction for a couple weeks, and their goal is to try to go back to in-person instruction in a couple weeks. So you can just Google, schools and COVID-19, and you're going to find multiple pages now of every day it grows of situations with schools having to close. So it's certainly going to happen. We've seen COVID-19 spread in a lot of environments where everyone was doing everything they could to be safe. Long-term care, medical facilities, the health department. We've had clusters in 2 of our health departments and had to close for a week to sanitize and take care of our staff. So even when you're have people spaced out very far apart and you're super vigilant on following the guidance, it can still get in and spread. So it will get into the schools. But anyway, we're all trying to do the best we can to work through this. I know the communities are struggling. We're struggling with those things too. There's no group of people, I imagine, that want COVID-19 to be over any more than public health. We've been dealing with this nonstop since March, 7 days a week, 24 hours a day. We're tired. We're wore out. We're beat up by the public. We're beat up by the number of hours we're having to work. We're beat up by the loss and the death and the suffering, and we're beat up by the cost to society. We really, really wish this was over. Anyone that thinks we would be doing anything to try to prolong this thing, you're sorely mistaken of the human toll it's taking on us. We certainly don't want it to continue. So I guess I will pause with that as my opening comment, Tracy, and we'll segue into the questions unless Stuart or Dr. Wayman wants to add something to anything I've said.
Okay, I do want to remind everyone that in the chat box, if you have questions as we walk throughout the rest of the meeting, please type those in and we'll answer those as they come up. So the first question is going to be for you, Dr. Wayman. Why does a person in isolation with a positive result not have to retest in order to be released from isolation with a negative test? There's a couple of other sentences along with it. At one time, a person was required to have 2 negative tests before being released. But now it looks like cases are being released by the discretion of a worker without any additional required testing, even when a patient is still symptomatic. What assurance is there that the patient is not carrying the virus for longer than someone else, and they might be without additional testing? So I guess the question is, okay.
Basically, we extrapolate from studies that have been done. So studies have shown that people are most infectious the day before and the day of symptom onset and become less and less infectious over time, and non-infectious when symptoms are much improved. The PCR test picks up viral RNA and is very sensitive. It does not distinguish between viable virus and remnants of RNA. In studies where the virus was actually cultured, there was no viable virus found in people who had recovered, even if they had positive RNA results. Hence, we use the CDC's non-testing recommendations to determine when someone is non-infectious. The criteria for this are that it has been at least 10 days since symptom onset. Some people are not released for up to 20 days, depending on their symptoms throughout their illness. They haven't had a fever for at least 24 hours, and their symptoms are much improved.
Okay, thank you, Dr. Wayne. Next question looks like this one may be for you, Sean. Last week, you shared that the numbers available for total number of tests administered by county was not available. However, these numbers are available at the state level. Is the Lake Cumberland District Health Department okay with not having access to local numbers? And also, have we taken any steps with the state to put a system in place for the total number of tests to be reported to counties?
Well, let me make sure we all understand what it is we're talking about. The thing about tests is you use if you have the data, you can take the total number of positives and divide that by the total number of tests administered, and you can get what's called a positivity rate. And that's a number that's really in the news right now because the federal government and the state government keeps talking about positivity rates. I'm not so sure why everyone is so enamored with positivity rates. It's only one measure of this disease. It would be nice to have those numbers, but there's plenty of other data we have locally that tells us whether or not the disease is spreading. We have new cases today, new cases that we report each day. We have the mortality rate, we have the hospitalization rate, we have the infection rate, we have the growth rate. There's lots of other information that can be used for that. So, but anyway, positivity rates become interesting. Have we done anything? I have put a request into the state to provide that information locally. I don't know if you watched or not. Probably most of you didn't. I didn't either. I was in another meeting, but the Commissioner of Public Health and some of his chief staff testified at the state legislature about why those numbers weren't available locally. And I'm not going to try to speak for them. They just said the information at even the regional level was unreliable. I don't know this. I assume that the numbers, maybe the companies that are doing the labs give some sort of overall weekly report or daily report to the state about the number of tests given statewide. The numbers are sort of unreliable because people travel from multiple places, counties, to get the tests. It's just really hard to know that the information in the testing data is accurate to your county. Would it be nice to have the numbers? It would be nice to have the numbers, yes, because it would be nice because people are interested in the positivity rate right now. As I said, it's just one measure, and it would help us know something. Of course, the positivity rate is there's different ways to look at the positivity rate. You can look at the positivity rate for one testing event, or you can look at your overall positivity rate since the beginning of the outbreak, or you can look at your positivity rate by week or month or whatever. A lot of ways to look at the data. We have made some efforts ourselves to reach out to at least local providers that do testing to try to get some idea of how many tests are done. We don't believe by any stretch that we have comprehensive or reliable information that's worth sharing to the public. I can tell you, with what limited information we've had, the best we can tell, our numbers align pretty closely with what the state numbers are reporting. So I feel pretty comfortable going with the amount, the positivity rate that the state's reporting. Whether I feel comfortable with it or not, we just don't have access to that information locally. Medical providers, labs, they're required to report to the health department positives. They're not required to report negatives. They're not required to report the number of tests given. So, we just can't calculate that number locally because we don't have those numbers. So I have, just so the public knows, I have made our master data set of information available, mostly because the schools were wanting it. Up until they started asking for it, no one had ever asked me for it, but it is on our website, on our main COVID-19 page at the bottom of the page. It's got it's by county, cases by date, hospitalizations by date, mortality by date, and so forth. It calculates the growth rate, mortality rate, hospitalization rate, and so forth. So you can get a copy of the master data set from our website if you're really interested in numbers.
Okay, thank you, Sean. Next question. The director of CDC says that schools should be in session. Why are we not following CDC guidance on this health issue while we do for other issues?
Well, I can't speak for the governor. I can't speak for the president. I can't speak for the CDC. I can only, there's all sorts of other influences that they're taking into account when making these decisions. Personally, and Dr. Wayman may want to add something from the medical director perspective. I mean, my personal stance on this as a health department director for 20 years is, any event, when you're only thinking about the disease and how quickly it spreads and how many people that it kills, when you're thinking about a pandemic, anything that encourages social gathering should be discouraged. And I know society will only tolerate a certain amount of restriction, and policymakers at all levels of government are trying to decide how much normal we can have without having a unacceptable spike in cases. So, all I can say is anything that encourages social gathering during a pandemic should be discouraged. And, I'll just live with whatever decisions that the policymakers make, just like everyone else does. Dr. Wayman or Stewart, do you have anything to add to that?
No. Okay, I have a question that came from YouTube Live now. Do we know when recently approved and quicker response time saliva test might reach Kentucky testing centers? I guess that's you, Dr. Wayman.
Dr. Wayman might know that. We were just talking about it the other day.
Actually, I don't know when it'll be available because I think it depends on the purchase of the actual machines that do the testing. And that will probably be the holdup. I suspect a lot of places will want them. I know it is approved and it sounds like it's going to be a real breakthrough when we finally get them. We will keep you posted.
Okay, thank you, Dr. Wayman. I have another question for you also. Is a KN95CE certified manufactured to EEA standards disposable mask better than the 2-layer cotton mask?
The answer is possibly. There is no direct data that exists, but in some studies, surgical masks were somewhat better than cloth masks. N95 masks have to be fit tested and worn properly. If they are not, they are considered just like a surgical mask. To my knowledge, KN95s are all manufactured in China and they have not been certified in the US.
Okay, thank you, Dr. Wayman.
As 95s, they can be used as surgical masks.
Okay, thank you. Next question, I think this one is for you, Sean. What is the breakdown for cause of transmission of cases in Macquarie County? And they're talking about business, travel, etc.
Yeah, if you're referring to the donut chart we have on our website, you will make a note. There are footnotes to that particular chart. I used a donut chart instead of a pie chart because a pie chart would assume that you understand what 100% of the data is, that you have so many items and you're dividing it out. In that particular chart, it's not an exhaustive data set, meaning that we don't always know where someone got a case from or if they were tied to anything else. And the categories aren't necessarily mutually exclusive, meaning that you can have been positive and been to church and been to work and been at home. So your one person could tie to 3 different things. So as you look at that chart, just understand what it is. And right now, I don't know what right now is. But when I wrote this information down, I don't break that particular set of data down by county. It's a very large, complicated file to get to work correctly. So I only report that on the district level. Since this particular question was asked, I did take the time to delete out momentarily all the data except for Macquarie County so I can answer this question. And this is only for active cases. I had that for Macquarie County, 27% of what we know had some tie to family, meaning that you had gotten it from mother, father, son, daughter, brother, sister, or you had exposed mother, father, son, daughter. 18% had some tie to travel. 18% in Macquarie County had some tie to jail and prison. That was of current active cases. 18% recreation, 18 government facilities, and that was it for Macquarie County. That changes each day. Right now, I think last night when I ran the numbers, long-term care facilities for the district jumped back into the lead for the number one. Well, that's because we're having some significant long-term care clusters in our district right now, one in Greene County and one in Pulaski County. So they had, fortunately, fallen back way far behind for several weeks, which is good because that's our highest risk population. And if you're having an outbreak, you're going to have more hospitalizations and mortality. Even though, as I said earlier, only the riskiest or only the highest risk population, you know, they still, a lot of people other than that group pass away, and a lot of people end up hospitalized that's not in that group. But they are certainly the most difficult group to have to deal with, the long-term care facilities. So long-term care facilities took the lead. For the last few days, it's kind of been bouncing back and forth between families and recreation. Just recreation, because a lot of people get out and do stuff in the summer. You know, they're playing sports or having cookouts or just doing things with people. Travel, as we're coming to the end of vacation season, travel is backing off. I would expect school-related issues to start moving up as we're having schools reopen. That's something we'll watch. But again, that data changes every day, so just watch our website.
Okay, thank you, Sean. The next question I think is going to be for you also. What do I do if I had a close contact with someone who tested positive for COVID-19, but I have not been contacted by the health department? And then what is considered a close contact?
Well, I took the first shot at answering this, but if I mess it up really bad, Dr. Wayman can rescue me. As far as close contacts, the definition that we're using here in Kentucky is 15 minutes less than 6 feet away. I think at the state level, some locations may be using 10 minutes less than 6 feet away. So somewhere in the 15, at one point, I think it was 30 minutes, but the guidance changes over time as the researchers and things investigate this more and learn more about it. The definitions change with time. So 10 to 15 minutes less than 6 feet away is current. We rely on when we do the case investigation, we rely on the person that we're interviewing to tell us the truth about who they were in contact with that met that criteria. If they don't tell us, we can't know. You know, we don't know what we don't know, so we have to rely on folks to be truthful with us on who their close contacts are. If they reveal that information to us, we reach out to the close contacts and further assess the situation and give them instructions. If you feel like you have been a close contact and you haven't been contacted by the health department, you're welcome to call your local health department and talk to one of the local nurses there. They're very familiar with assessing risk. At this point, we've been doing it almost nonstop for several months. I'm sure they could very quickly ask you the questions and tell you whether or not you fit the criteria. I would say anyone that thinks that they could have been exposed, you should quarantine for 14 days. That would be the safest thing to do. So now I'm going to let Dr. Wayman rescue me with anything I messed up on.
That was perfect.
All right. I get messed up a little bit because the criteria changes, and I don't stay on, as the director, I don't stay on top of that as much as the medical staff do, so I thought she might have enough.
Yes, we would like people who are to contact us.
Yes, if you think you've been a contact, reach out to us. And if we call you, answer the phone, and, you know, all of those kinds of things. So the people in our community are basically, I don't know that I would say overwhelmingly, but the greatest majority, we are able to make contact with, and they give us good information as far as contacts. You know, most people are cooperative. You do run into a few people that are oppositional and don't want to cooperate, but it's a minority. We have basically pretty good people in our district. They're just country people that try to do the right thing. So that's good.
All right, thank you. Next question. If I think I've been in contact with someone who has tested positive for COVID-19 and I have no symptoms, should I be tested and isolated?
I tried to answer this one too. Again, Dr. Wayman might have to rescue me. We recommend that you be tested if you have symptoms. If you feel like you need to ease your mind about the situation, you can be tested. If you can, you know, make the appointment, find the places that are providing the test. And again, if you feel like you're a close contact, you should quarantine yourself for 14 days. You can always reach out to the health department to get screened and get further advice. That's kind of generic advice. What do you want to add, Dr. Lehman?
Only that if you get tested and you get a negative, then that's just a one point in time. And it doesn't say that you won't be positive in a few days.
Yeah. You know, even with some people that I'm personally close to, that I know personally who have tested positive now, they were probably exposed quite a few days ago. I mean, we quarantine people for 14 days. You generally think those symptoms are going to pop up in 5 or 6 days, 3, 4, 5, 6 days. Some people, it really don't pop up until closer to the end of that 14 days. I've seen that happen for real now. And there are situations where you almost at the end of your quarantine and you start feeling bad and you get tested, and man, there you are. So the rules are in place for a reason.
So next question, I think this one is for you, Stuart. My husband and I was at a local doctor's office this past week. Upon entering the building for our appointment, the personnel asked that my husband and I take off our mask for a temperature check. They used a mouth thermometer. We have both stayed at home like the governor asked, but felt like we were at risk by them asking us to take off our mask. So we just canceled our appointment that day. Is this proper protocol?
Okay, so in the guidance, it does say that when you're visiting the doctor's office that your temperature should be taken. It doesn't talk about the type of thermometer that should be used, only that you need to be screened for a fever. So with each type of thermometer, you have some positives and negatives. Of course, with the mouth thermometer, they're much more accurate than the no-touch thermometers are. And with the no-touch thermometer, there's no use to, it's touchless, so you don't have to sanitize after each use. But if they are using a mouth thermometer, then they need to sanitize that after each use. And the staff that are taking the temperatures, they need to make sure and be masked also, since you do have to pull your mask down for them to do that.
Okay, thank you, Stuart. Next question. This may be Sean, I guess, potentially, or Sean or Stuart. My daycare was shut down this week because of COVID-19. Can you tell me the symptoms I need to look for in my child? Will they be different than in an adult?
I took the first stab at answering it. When I say I took the first stab at answering this, we accumulate all these questions each week and distribute them to the team to answer. Lots of times I'll go through and do a first draft of answers just to take some of the workload off my peers who I know are having to work very hard. And I guess if they are satisfied with my answer, they pass over it and go on. But certainly if Stuart or Dr. Wayman feel like they have something to add or more expertise, or if I'm wrong, they can correct me or append what I'm saying. Just for clarification, the health department doesn't shut down daycares. It's possible if you have a cluster in your daycare that so many of your children and maybe your staff get quarantined that it's not feasible to operate anymore, but we wouldn't have shut you down. You would have shut down because you didn't have enough children or staff to operate because of the cluster at your location. There's a tremendous number of times that children, even if they're positive, they're asymptomatic. Now, people confuse what asymptomatic means all the time. Asymptomatic means you're positive, you're just not showing symptoms. Children can be positive and not be showing symptoms. If your child was designated by the health department as a close contact, then they should quarantine 14 days just like anyone else. So Dr. Wayman or Stuart, you may have more to contribute to that.
Well, all I would say is that the symptoms can be the same as in adults, which are fever, sore throat, cough, diarrhea. They usually are mild and the children recover quickly.
Yeah, what about you, Stuart?
Just as far as the shutdown on the first of the question, like Sean said, I mean, we did not shut the daycare down, but what does happen, and the same may happen in the school situations, that due to the number of children out or due to the number of staff that are out, either as positive cases or as quarantined contacts, that in and of itself can shut either a daycare or a school down.
Yeah, and it would be the superintendent or the school board, probably the superintendent, making the decision for the schools if they close. And they would make that decision based on their census or how many kids are at school, how many staff they have. Kind of like the same way they make decisions any other time they would close, if they have to assess the situation and decide whether or not it's, appropriate at that moment to keep going. For public health response, we will treat schools the same way we treat anyone else in our district. And what I mean by that is if you've been exposed, we will use the same criteria to quarantine students in a classroom as we do to quarantine employees in any other setting, at a factory, at a doctor's office, at a restaurant. If you meet the criteria to be quarantined, you'll be quarantined. In some of these situations where you have students in a classroom where they've been in the same classroom with each other all day, it could result in a significant number of quarantines. So, those situations get really tricky when you're in a small space, a classroom, with a good number of people for several hours. I mean, we've seen it spread through churches when you get a good number of people in a building for 1 hour. So that's less several hours. So anyway, but it wouldn't be us shutting down the schools. I mean, I really, really hope with all my heart that the schools can open safely and that the disease won't spread. I don't think what we're seeing in the data right now about what's happening across the nation with schools that are opening up supports that this is going to be easy to do. But we don't want the schools to fail. We want things to be as normal as possible. It's distressful for us to have to deal with these failures because there's consequences when there's cases. There's work that we have to do and staff that I have to have work nights and weekends and we don't want the system to fail. We want it to work.
Okay, next question. Are there any new recommendations for people in this area that are planning to go on vacation?
I haven't looked at on the Kentucky COVID-19 website. Stuart looks like he's looking it up right now. They keep a list of any states whose positivity rate is higher than a certain number. Is it 10%, Stuart, or is it
15.
15%? So I was wrong twice. 15%. So they keep that listed on that site. I haven't looked at it in the last couple of days, so Stuart will pull it up and tell you. This is one of those situations where positivity rates comes into vogue. And again, I assume at the state level, maybe the labs are required to give a weekly or a daily report to the State Department for Public Health about the total tests given, so they can have some statewide average, but certainly that number is not given to us locally. So did you find this?
Yeah, so just for clarification, actually, it does talk about a 10%. So on the quarantine, the Department for Public Health recommends a 14-day self-quarantine for travelers who went to any of the states reporting positive testing rate equal to or greater than 15% of COVID-19. And it is recommended to use extra precaution traveling to states reporting positive testing rate equal to or greater than 10% of COVID-19. So right now, our states that are over the 15% or over are Mississippi at 23%, Florida at 16%, Nevada at 17%, and Idaho at just over 15%. So there's only 4 states on the advisory to quarantine if you do visit those states at this time.
It's interesting that I only know this information because I just happened to have a routinely scheduled Zoom meeting with my health department peers across the state on Tuesday. On very short notice, a team from the federal government, from the CDC and what's some of those other disaster departments? FEMA was part of it. Anyway, from several of these federal agencies came for a pretty much unannounced visit. It was a very shortly announced visit to Louisville to us, and they picked Louisville because Louisville has a fourth of our population, and are currently they've achieved a high status of cases. Anyway, they came in to evaluate the situation and to see how Louisville was doing, and best I can tell, they felt like Louisville was doing a pretty good job. But my point is, they came because from their perspective, Kentucky was on the verge of being the next state to tip toward being one of those really high-level states where the transmission and stuff was going to happen. So they were there kind of as a precursor to what they thought was getting ready to happen in Kentucky. Now, whether or not that ends up being true, I don't know. It's just interesting that they felt like Kentucky was on the verge of a major tipping point with this thing. So I guess we're going to find out in the next 2 or 3 weeks whether that comes to pass. Let's see. Judge Craig asked a question, Tracy. It looks like, do you know if a person who has tested positive, will that person always have to have it dormant in their system, or does it completely go away? That's a good one for Dr. Wayman.
We think that it goes away, but apparently there have been a few people that have been documented in the literature who had recurrences, in which case, as opposed to being reinfected sometime later, so maybe in a few people it remains, but in most people we don't think so.
Yeah. And whether or not you build up a lasting immunity to it, if you've had it, the verdict's still kind of out on that. It could be that if a vaccine's developed, you might have to take it more than once. The best vaccines you take once in your lifetime or once in a couple boosters. some vaccines you have to take annually, and this could be one of those. I don't know. You know, we don't know. This virus is, I think, still less than a year old, and it's not, you know, flu's something that's been around for as long as people have understood what viruses were, I guess. So we've had lots of years to study
Before.
the flu strain. This particular strain of coronavirus is brand new to the human species. Now, coronavirus itself, the family of viruses called coronavirus, there's you know, those have been around for a long time, but this particular offshoot, or I don't know what the right word is, of the virus is brand new to the human species. So still learning about how it works, how long it's going to, how long the impacts are going to, you know, if your body, if you've had it and recovered from it, how long that you're going to be resistant to it, if there's lasting consequences to this thing, or if there's symptoms that, or if there's some sort of consequence, health consequence, you know, several months down the road, once you've recovered, that pop up. I mean, there's stuff we're still learning about this all the time.
COVID-19 is interesting and keeping us all on our toes, isn't it? That's all the
Yes.
questions I have, Sean.
All right. Stuart, do you have any wind down thoughts for us today? I usually do this while I'd make the announcement that our Zoom broadcast that we do this on, it's about 20 seconds ahead of our YouTube feed. So I generally try to delay for about 20 seconds to make sure there's not a final question someone wants to ask. So, sir, you got any closing thoughts for us today? I'll throw you on the spot under the bus.
I'll just kind of to go back on to that last question. I mean, I know we've talked a lot about school, so I'm not going to talk about school for my closing thoughts. What I am going to talk about is just remember, when you are traveling, doesn't matter where you're traveling. I'm talking about traveling to another state, traveling to the state with the highest positivity rate right now, which is Mississippi, or if you're traveling to Tennessee, or if you're traveling over to the next district over, Bowling Green. So anytime that you're doing that and you're around people, you need to make sure that the most important thing is that you avoid those crowds, that you wash your hands, that you wear your masks, and you sanitize frequently. So it doesn't matter if the place that you're going is over a 15% rate of COVID positivity rate or not. Anywhere you go, when you leave your home, anywhere you're around other people that are not your in-home contacts, then you need to have that on your mind, and you need to have that in the forefront of your mind to practice good and safe public health, so that you yourself don't become infected and become sick, or somebody that you don't infect somebody that you know.
And Dr. Wayne, just a thought, you know, as you look at the trend data for COVID-19 across other nations and across the different states in the United States, the way that jurisdictions have gotten control of spikes has been through artificial interventions like shutdowns, lockdowns, masking requirements, and things like that. And that has resulted in slowing things down. So, you know, we're at a place now where we're trying to see how much society we can get open. I think I'm right about that, though. I mean, generally, that's how it gets slowed down. So why am I bringing that up? And Dr. Wayne, you'll probably know this. I think I looked it up the other day, running on my memory banks. In a regular flu season, I think it was the number I'm thinking is worldwide. A regular flu season kills about 250,000 people. I think that's the world number, and a bad flu season is about 500,000 people. Is that?
Worldwide, I don't remember. I know in the States it's around 36 to 40,000.
Okay, so my numbers probably extrapolate out, so that's probably, I'm probably remembering correctly.
They think that I
That's
had data.
about right, I think.
So this virus is getting close to 900,000 right now worldwide, so it's already, and it's not, its season is not over. We've worldwide, nationally, locally, I mean, we're about 1% of the population that's been impacted, and it's killed about 400,000 more people so far than a really bad flu season. And we've still got 99% of the population to go. Now, I know there's people that's had it that we don't know about, but even if you say we got 60% of the population or 70% of the population, still a lot of carnage that can come out of this. And it is really worrisome to think about how this thing can start growing exponentially so quickly. And the only way you can slow it is use these artificial interventions that everybody, well, I don't know about everybody, but a lot of people hate. A lot of people hate being told we got to lock down, or hate being told I have to wear a mask or whatever, you know. But man, it's when you really start looking at this thing and looking at the data and researching it, it's a pretty scary thing. Just because we haven't seen all of the carnage that could have happened if those artificial interventions hadn't happened. I mean, I think people kind of want to be dismissive because they haven't seen the disaster that was prevented. And man, if you just let it go, how catastrophic this thing could be. So, you know, I could talk about this for a while, but I mean, I'm really hoping there's a vaccine developed before long. So hopefully we have a way that we can vaccinate people to avoid all of that catastrophe, as opposed to having to use lockdowns and all that other kind of stuff. I'd love to have a vaccine option. So I don't see any more questions. I guess, Stuart, I ended up doing a closing comment too. Dr. Wayman, you want to do one also? We've both done one.
All I have to say is wearing a mask is a lot easier than being in lockdown.
Yeah, and it's a lot better than being in the hospital on a ventilator too, you know, and all that kind of stuff. Tracy, what about you? You have any closing comments? You're moderating for us, but.
I do not. I think we all need to mask up and social distance and make sure and use hand sanitizer or wash our hands frequently. That's my comments I would share.
Last night in my daily brief, when I wrote it, I was thinking about, you know, it's easy for us in public health to think about how this is impacting us. And, you know, last night I was thinking about there's a lot of people that's impacted by this in a lot of ways. I mean, a lot of financial difficulties that people are going through, kids not being able to go back to school, folks not being able to visit their parents at the nursing home, businesses closing, you know, I mean, there's just all kinds of people that we need to keep in our hearts and in our minds. And we all together need to try to wear our masks and social distance so we can be as free as we can be and keep this thing in check until there's a vaccine. I'll close with those thoughts. Appreciate everyone tuning in. We have 57 watching live now, and usually there's a few hundred that watch it after the fact. So if you ever have a question, you can submit it to your local health department. How would they submit a question, Tracy? The media submits questions. They can, other people could submit a question through live chat, or is there another way?
Yes, through their local health department, their health educators, they collect questions on the local levels. And then Melanie Williams here at the district, she gets questions also. And I encourage you all to please submit those questions and we will answer them next week.
All right. And thank you all for tuning in.
Thank you. Have a good day.
Bye-bye.